private and the faith-based.
Okay, Senator Seki.
Thank you very much, Honorable Speaker. Honorable Speaker, I think these are very important questions from Honorable Wambua. And I think the CS need really to understand that the entire country is listening to her. And she needs to give answers because people are waiting these answers. Honorable Speaker, I want to request that the CS, if she's aware that, and I think the same thing, when Mheshimiwa Mandago was raising her questions on the debts that the national government or KEMSA is another issue that has not been responded to. But nevertheless, I want to say, I request the CS, if she's aware that civil servants are not getting treatment or denied treatment in private institutions, and now because it is because of the debts that the government owed through NHIF and SHA, if she's aware. Again, this has also translated to the injured police officers who have been injured while on duty, that they have a lot of debts that is accruing in NHIF for insurance company not paying to the officers who have been injured while on duty. But the reason why I ask this question is if the CS understand that civil servants, police, teachers, and all civil servants are not giving or not getting treatment in private institutions because of the debts that are accruing, that has been there in NHIF, and you've shown how the figures has been given or has been transferred, and that transition is really bringing a lot of problems. So, Honorable Speaker, I want the CS to answer that question. Thank you.
Actually, that question is just related to what Senator Ambua was trying to pursue. So, when the CS is responding to the senators, kindly, you should be very keen so that you can understand. Otherwise, we will stay with the same question, the same answer, the whole morning. But do you have a different answer? Madam CS? Yes? On civil servants?
We don't have the, another answer. That is the same. We acknowledge the greatest concern is the NHIF debt. And we acknowledge that. And we as a ministry are looking to see how we can ensure that the debt is paid. So we acknowledge that, and we are reviewing to ensure that we are paying the debt. Yeah.
Senator Agnes Kavindu.
Thank you, Mr. Speaker. My question is also related to those ones, but on a different direction of human resource, as in the doctors. Most of our people go to hospitals in the dispensaries and level 2s and level 3s, where the people who are working there cannot minister high blood pressure medication or those kinds of medication. So they are forced to go to level 4 hospitals or level 5, and they are not able to go there. What are you going to do about those dispensaries and level 2s so that we can have at least a doctor there who can tend to the old people in the villages who go to such hospitals for attention? Thank you.
Yes, yes.
Thank you for the question. So we have our blood pressure modification medicines in level 3 onwards. Yes, we acknowledge that we don't have sufficient doctors in level 2 facilities, But we are working together with counties. Again, we've had best practices like rotations within these levels of care, the lower levels of care among the medical officers. And so, yes, we acknowledge, and we will have the blood pressure medications are from level 3. Yes, thank you.
Senator Veronica Maina.
Honorable CS, welcome to Senate, and we are wishing you a good tenure during your term of service at the Ministry of Health. CS, you have stated that, and aptly stated that SHA aims to provide affordable, accessible, and quality healthcare services to Kenyans, which is ideally the main objective of SHA. As a matter of interest, RUFA had threatened to suspend provision of healthcare services to patients, and we would like to know whether that threat was effected yesterday. I hope it was not. And we would want to know how the ministry has structured the claim of the 30 billion that RUFA is claiming. Have you arrived at any conclusion or negotiation or any mediation process that could have settled that claim, which was incurred by the now defunct NHIF and which is being demanded from SHA? What measures have you taken to ensure services are not suspended for the ordinary Kenyan?
I want to guide in this manner, because these questions are almost similar. I want to get like 3 or 4 questions, and then she can answer them, because they are almost similar, these questions. In the process, what clarification? And she has even not answered you. I don't give the mic, of course.
Thank you, Mr. Speaker. Mr. Speaker, the CS has told me that the high blood pressure and diabetes medication is in level 3. How will the people in the village know that that medication is in level 3? What are you doing in cooperation with the counties to make sure that the people know where they should be going? Because they go to the dispensaries, they go to level 2, and they are told we don't minister those kind of medications. Can there be a way of reaching out to Mwananchi to know where they should go for diabetes and high blood pressure and arthritis, because those are the sicknesses that are down at the ground?
Next is Senator Morango. Do you want to respond? Do you have a supplementary question, or do you want to ask your question?
Asante sana mstahiki Speaker. Ningetaka kumuuliza waziri kama amesikia kilio cha walimu, masikitiko ya walimu na uchungu wa walimu ambao walikatwa zile fedha za SHA, lakini zikaenda kwa hazina kuu ya serikali na haikufikia zile hospitali ambazo wanafaa kwenda kutimbiwa. Na bado wako na kandarasi na bima zingine ambazo zinafaa pia kuwasaidia katika mambo ya matibabu. Kwa hivyo swali langu ni hilo, kwamba kama ashajua, na kama ashajua zile shida ziko na walimu, amefanya nini kuhakikisha kwamba amesuluhisha ili walimu waweze kupata huduma? Asante sana Mr. Speaker.
Answer those 2-3 questions. The question by Senator Veronica and Senator Morango, and the clarification sought by Senator Agnes Kavili.
Okay, so I will start.
And then I'll be going to the third question by Senator Aminda Kibwana.
I'll start with the blood pressure question. And so with regards to hypertension and other non-communicable diseases, really communicable and non-communicable diseases in Kenya, we have more than 106 community health providers, health promoters who have been onboarded on the NHIF platform, and they have been able to register more than 8 million Kenyans out of the 12.5 million households. And they've been able to revisit 7.3 million households, and they've been able to screen 28.2, they've been able to screen patients for diabetes and hypertension in these areas. So we've been able to screen Kenyans, 340 of them who have been referred for diabetes, and 730,000 who have been referred who had hypertension. So the community health promoters are indeed a critical platform that we are utilizing within the community to educate on preventive, promotive healthcare, and then also to identify and refer these cases. Additionally, even for level 2, yes, we have human resource like the nurses there who are able to identify the patients who have hypertension and refer them to higher levels of care. And so we continue with training and capacity building, mentorship and supportive supervision for our CHPs and our healthcare workers to ensure that they are identifying. And indeed, they have been a critical pillar and a game changer in regards to identifying these conditions that were once affecting our people. So again, just to emphasize on the NHIF debt, we are acknowledging the debt is there, and we are again looking at the payment plan. And really this is the main concern with the private and the faith-based organizations. So what we have requested is that they submit all pending claims for verification, and then payment will follow in suit. So maybe even to give you a background, there was a press release yesterday by the SHA team, and what you can see, there's a lot of effort going towards payment of the social health insurance fund. We've been able to pay 5.1 billion. And the concern they have is not Social Health Authority. It is indeed NHIF pending bill. For SHA, we've been able to pay most of the time within 30 days, and the ones that were not paid were maybe the claims of which they are reviewing, and quite a good proportion has been paid. We are also having transparency and visibility, and really engaging them to ensure that this continues with regards to claims, where they are and how we are progressing forward. So instead of 90 days, we are actually paying within 30 days, and we are pushing for the acceptance of this. But for the NHIF, again, we acknowledge, and we are looking for the resolution process in this regards. Teachers, like any Kenyans, have been able to pay the premiums that are entitled, and so they are able to access the SHA benefits that have been given to them. Again, teachers through the TSC, they use their private medical insurance. This needs to be paid by the TSC. At times they mix SHA and TSC medical insurance. So this is a different scheme which needs to be paid by the TSC. It is not SHA. But with regards to SHA, after registering and after paying their contributions, they are able to access the services under SHA. And maybe also to emphasize, at times, the employers say they have paid, but they have not remitted. And so again, we are brought on board and told that we are not offering SHA services, yet the concern is on the employer side. So we are also emphasizing and negotiating and ensuring that the employers remit. That way we can improve the noise that is out there. Thank you.
Dean of the Majority Party.
Thank you, Mr. Speaker. Mr. Speaker dictated to us a question which has been clarified on those what are they called, the pending bills with specific reference to faith-based hospitals. And I wish to urge the minister to perhaps separate between private facilities and faith-based hospitals, because I know for a fact that some of these private facilities, if you look at the debt burden, it is mostly heavy on the faith-based facilities for reasons that every Kenyan knows, that it is difficult for any faith-based institution to do some of the things that private facilities are able to do to get their payments faster. And perhaps that matter needs to be treated with more urgency, Mr. Speaker. However, because I've gotten the mic, I want to register my comments alongside that of the chair of the Health Committee, that I am terribly disappointed by the conduct of this ministry, led by the Health Minister, together with her 2 PSs. They have treated this House with serious contempt, and that is not something that I take lightly as Majority Leader in this House. The fact that they missed our midterm review meeting, Mr. Speaker. The Cabinet Minister says she was in Cabinet. What about her 2 PSs? Where was Harry? Where was PS Mudhoni? Couldn't they find their way to Naivasha? How can you continue to interact with colleagues whose only interest with health matters is a budget allocation to your ministry? All policy-related matters are implemented at the county governments, Mr. Speaker. You can hear the kind of questions that senators are asking. Some of them is purely on account of the fact that this ministry has failed to interact with this House in the manner that it ought to be, Mr. Speaker. If there is a big failure, Cabinet Secretary, that I want you to register as you leave this House, forget about Chief and Shah, much as those are very important issues, is the fact that you have not been able to lead your ministry to have a serious engagement with the Senate of the Republic of Kenya. And for that, I hold no other person responsible other than you, Madam Minister. And that is not something that is acceptable to us. Therefore, Mr. Speaker, I want to agree with your finding that when the minister returns to her office, can she find the time to come and provide an update on all the issues that he had been requested to come and present before a midterm review meeting, and ask for a time that we avail? This House is available on Tuesday mornings and Thursday mornings. Can she pick a day in the next 2 days if she wants to restore normal relations between us and the Ministry of Health, Mr. Speaker? Otherwise, I am terribly disappointed, Madam Minister. And PS Harry knows this, PS Mudhoni, you know this. You are my good friends, but you have let your boss down. You need to work better with a House. We passed those 4 laws, Mr. Speaker, knowing that SHA was going to be transformational and change the lives of Kenyans. Do not sit in your office, Madam Minister, and listen to your choir of office officials. Come and listen to the representatives of the people to tell you the challenges that people are facing. I rest my case, Mr. Speaker.
Now, Majority Leader, you know, I navigated that matter and I gave guidance. But since you represent the majority side, you have pushed a lot of business from the Ministry of Health. We did actually bills at night, at midnight in Turkana, I remember. So, Madam CS, that every voice coming from the majority leader, you should know things are not okay, yeah? Coming from the majority leader in the Senate. So you really need to organize yourself, reorganize your team, take time to listen to the legislators. You know the Senate is a house of reason. Things that you cannot be able to be told by other people, you can be told by the senators, because we really want, I say it again, devolution to work. Most of the health issues are involved. So most of the time we spend with the senators because you know what is happening in the counties. Don't spend your time chasing for money in the budget of, in the National Assembly. After you chase your money, then come back for policies from this House. You can see there is almost more than that, the senators are here to listen to you and to dialogue with you. And as I put it, find your time. The time we are located in Naivasha, I repeat again, find your time to sit with the senators. There is a time you came to the National Assembly and you requested us to join you there. We had no time even to ask a question. There was absolutely no time. So what you did at the tent there was not enough. We have many questions. It's only that I'm chairing. Actually, I could have manned you with so many questions if I was sitting on my seat here. So, as I and senators, let me get 3 more and then we move to the other question. Senator